But the good news is, it's not 100%. It's not the ideal. It's just reasonably careful. And, what does that mean? So I think we're at a point with LENAP is where we're talking about what are the patient's choices. And again, here's the California jury instruction. And what it says is it's not enough that the patient consents to the procedure. They must be given informed consent. They must be given a sufficient amount of information. And we're going to go over what the ABCs of informed consent are in terms of the alternatives, the benefits, and the complications. I think it's just easier to remember the ABCs. And if you go over this with the patient, you can say, well, let me tell you about the ABCs of LANAP or virtually any other procedure that we can review with you, and so the patient can have the right information. And again, remember, it doesn't matter how many or how few offer it, it's what a reasonably careful dentist should do. So I can imagine, and I haven't seen the case yet, but it's only a matter of time. The case is going to be there. The patient will have had periodontal surgery. They're going to have a severe complication. They're going to have an infection, and I've seen infections. They've even gone to the actually brain injuries from infections that have traveled. We've all heard of the cavernous sinus thrombosis. There have been fatalities, and there's one thing about losing your teeth. There's another thing about losing your life, and these are the complications. And there's going to be some attorney someday who will say, did you give the patient the choice of LANAP? Because that risk would have been there. You wouldn't have had that risk for the post-op infection. You wouldn't have had that risk for maybe they had a medication and that they had a side effect. And they would not have had that kind of the Vicodin visit. They would have had a much more non-painful and non-complicated visit. What happens when you don't give the patient all the choices? So something that you can argue as an attorney at the end of the case, he had the motive, he had the means, and he only offered one method, which was the deep drilled veneers. Now, I can use that same argument in virtually any other case, and I can apply it to LANAP. If you say, look you only offered surgery, you never offered LANAP? Were you aware? Did you discuss? Did you offer? Did the patient choose? What's going to happen in most cases? So if there is a surgical complication, that is going to be something that some attorney someday, somewhere, and probably not too far off, the more LANAP becomes in vogue, will be offered to a patient.